Now we move to degenerative diseases of basal ganglia and brainstem. We look into Parkinsonism and Parkinson's disease. Parkinsonism is a clinical syndrome characterized by diminished facial expression, stoop posture, slowness of voluntary movement, fascinating gait, rigidity, and pill-rolling tremor. The principal diseases that involve the nigrostriatal system are Parkinson's disease, multiple system atrophy, post-encephalitic Parkinsonism, and progressive supranuclear palsy. The causes of Parkinsonism is still not fully understood. There are multiple interacting risk factors, including genetics. It usually affects those over 70 years of age, with a prevalence of 1 in 200 over the age of 80, and it is higher in men. There are a small increased risk with rural living and drinking well water, and there is association with pesticides exposure, and studies consistently show that non-smokers have more incidence of Parkinsonism than smokers. Parkinson's disease is a neurodegenerative disease marked by hypokinetic movement disorder, and it is caused by loss of dopaminergic neurons from substantia nigra. It is estimated that 15,000 to 20,000 patients suffer from Parkinson in Malaysia. The main feature of Parkinson's disease is tremor, rigidity, and bradykinesia, and the treatment is L-DOPA replacement therapy, which is used to increase dopamine concentration. Parkinson's disease is associated with protein accumulation and aggregation, mitochondrial abnormality, and neuronal loss in substantia nigra. The diagnostic hallmark of Parkinson is Lewy body, which is seen in the remaining substantia nigra neuron, as shown here. The major protein accumulated in Lewy body is alpha-synuclein, which are toxic to the neuron. Another cause of Parkinson's disease is impairment of mitochondrial function that results in cellular damage and is linked to aging and neurodegeneration. This picture shows the substantia nigra in a normal person. You can see this black area, and you can see there is pallor of the substantia nigra in Parkinson's disease. And the decrease in the dopaminergic innervation of the substantia nigra is due to either the protein accumulation, which are toxic to neurons, or mitochondrial dysfunction. Briefly on the treatment of Parkinson's disease, it works on increasing the levels of dopamine in the brain, and one of it is levodopa, which crosses the blood-brain barrier and is converted to dopamine. Another is bromocriptine, which stimulate the dopamine receptors in the brain. Next, we look at Friedreich ataxia, which is a spinocerebellar degeneration disease. Friedreich ataxia is an autosomal recessive disease caused by low levels of frataxin protein. It is due to mutation of Friedreich ataxia gene, and frataxin is needed for regulation of iron levels. And frataxin is essential in neuronal and muscle cells for proper functioning mitochondria. Patients develop progressive ataxia, spasticity, weakness, sensory neuropathy, and cardiomyopathy with concomitant diabetes. And most patients become wheelchair bound within 5 years of onset. This picture displays the pathogenesis of Friedreich ataxia. So when there is reduced frataxin, there is reduced ATP production because of reduced mitochondrial oxidative phosphorylation, and this will cause less energy for the cell and can lead to cell death. The free radical formation can also increase because of the increased free ion, and this will increase the oxidative stress, which can lead to cell death. Most affected cells are the neurons, the heart cells, and the pancreatic cells. Next, we look at amyotrophic lateral sclerosis, ALS, which is a degenerative disease affecting the motor neurons. ALS is a progressive disorder where there is loss of upper motor neuron in the cerebral cortex and lower motor neuron in spinal cord and brainstem. The loss of these neurons results in denervation of muscles, producing severe weakness as the disease progresses. One of the mutations that is related to ALS is the mutation in chromosome 21, which codes for the protein superoxide dismutase. Superoxide dismutase removes dangerous superoxide radicals by converting them to non-harmful substances. The mutation causes gain of function of the superoxide dismutase protein, and the aggregates of this protein causes cellular injury, which eventually causes neuronal apoptosis. The loss of upper and lower motor neurons will result in denervation of the muscle weakness, difficulty in fine motor tasks, spasticity of the arms and legs, involuntary contractions, and if it involves the respiratory muscle, the patient will have recurrent respiratory infection, shortness of breath, respiratory failure, and paralysis.